Go over what we found on the exam, and then we'll talk about the plan. Okay, so the patient presents with signs and symptoms consistent with cervical myelopathy and radiculitis. So myelopathy is cord compression, and the cord is being compressed from a disc protrusion identified on the MRI. Those are the ones you've talked to the surgeons who have said the best way to approach it is with an artificial disc replacement, and it's definitely an option, but it's a permanent option. And so our job is to explore the non-surgical options before you take that final step, including and not limited to whatever's available to us naturally to try to decompress those discs and strengthen the neck muscles. So even if it comes to pass that we can't entirely get rid of these symptoms, you at least go into the surgery with your neck stronger. Now, my feeling is, with the right sequence, doing enough decompression, we can get to strengthening your neck muscles using Med-X to build up the neck muscles so that your margin of error is much bigger than it is now. So margin of error is to say your probability of making things worse is high when your strength is low.
Correct.
Okay, so that's why people end up in this situation in the first place. But now that we're here, what do we do about it? Okay, so there's a disc that's protruding, myelopathy is cord compression, and radiculopathy is nerve root compression. So I'm going to show you on a lumbar spine. It's just easier to show because it's bigger, but it's the same basic anatomy. Okay, we got the nerve canals, and as the nerve canals, those are the exiting nerves. That's when they get impinged, that's radiculitis. When the cord gets impinged, that's myelopathy. Okay, so there's signs of both of those.
Right.
When a disc bulges centrally, it can go into the cord. Okay, and that's what they identified here, and that's what's causing the severe central canal stenosis. What's important to keep in mind that severity is a temporary situation. Okay, that your body can absorb that disc material that's not where it belongs right now. Mm-hmm. So the report can make it feel like it's permanent. And yes, a disc replacement would, as a surgical option, make sense. But there are non-surgical options that we deploy to lots and lots of people like you. So a trial of that takes typically about 20 to sometimes as many as 30 visits, but 20 is kind of the magic number in that it's enough time with decompression for us to be able to feel safe to put you on the Med-X strengthening machine without risk to the discs. Strengthen your neck. Okay, because you have to sit in a machine, you have to push a weight stack. Okay, but that wouldn't be the first thing we do because we've got a disc situation with a disc protrusion. So we have to decompress that, try to get some of that material back in, if not all of it back in. It'll be difficult to get it all back in because it's kind of a moderate size, but we're just looking for millimeters. Okay, remembering that the cord space, it's about 10 millimeters. Yes. When you have a 5 millimeter protrusion coming into that space, it's a small central protrusion, okay? But you can think of yours as kind of a broader bulge, and it's coming into the cord. If we can get 2, 3, 4 millimeters of that to recede, we've gained enough room to start strengthening your neck muscles, okay? Build up the strength, and then you may have some residual bulging still in that period, but with good, strong neck muscles, you can tolerate holding your head up, and the probability of that disc becoming a further problem down the road is much less than if we don't strengthen it. Okay,
that
so
makes sense
that's the basic premise of it. So I'll show you here. So the first thing we did is we just looked at the plain radiographs, the x-rays, okay? And the first thing we noticed is there's actually pretty well-maintained disc spaces throughout your spine. So that's encouraging. That is to say, we're not dealing with advanced disc degeneration, okay? So that's good. Now we also notice the neck is very straight. So a normal neck has a nice bow in it. Okay, so when it's structurally sound, it has a bow in it. So this is typical of when somebody's neck muscles aren't strong. So because they look down enough over their lifetime, they lose the curve because the neck muscles cannot hold the proper curve. Okay, so they get this sign of weakness, okay? We can't yet assert there's significant weakness only because we haven't tested it, but the probability is high that there's weakness, especially in light of the disc protrusion. So then we're going to look at the MRIs, and what you'll see on the MRIs is here's your spinal cord, okay? And the white around it is the cerebrospinal fluid. So there's a fluid that goes around it. And if we go down and we see nice white fluid all the way around, all through here, except right there. So if you look closely, you'll see that there's a pretty moderate sized protrusion sticking out of where it's supposed to be, okay? And then there's another one above it as well. Okay, so both of those during the exam, we did find what appeared to be some weakness. I'll go back to our exam in your biceps. It was the fifth nerve that appeared to be impacted. I'm going to read it. Okay, patient appears signs of cord compression radiculitis appears to be impacting the C5 nerve roots bilaterally. Okay, and if we go back to our exam, we'll be reminded exactly why. Okay, shoulder abduction and elbow flexion. Elbow flexion, biceps controlled by the C5 nerve. That may be part of the reason you're having some of those symptoms in your arm, yes. Okay, so between the C4 and C5, where there's the moderate sized central disc osteophyte complex, that is to say there's a disc protrusion there, that impacts the C5 nerve. Okay, so that's actually the one above. So here's 2, 3, 4, 5. So we'll also see another protrusion there. So that's the one that is impacting the C5 nerve, because that's where the C5 nerve exits. Okay, this is where the C6 nerve exits, and you didn't have clear signs of any weakness in that area. That's your wrist extension. Okay, it's controlled by C6, no obvious weakness. That's not to say there isn't compression on the C6 nerve, it just didn't show up as weakness, okay? But those are both problematic because they both have protrusions. The good news is with non-surgical decompression, it gently pulls, holds, takes pressure off of the nerves and the discs and the joints, and helps pull some of that fluid back in. And then as it releases, it pumps nutrients to the area. So the pumping effect is very, very important for that process, but it happens rhythmically, so we need to do it at least 3 times a week, okay? We also talked about some home traction, so you can also get home devices, so that when we hand you the baton, that is go home and do your home care, the healing continues once you leave. So we take 2 steps forward with the intention of sending you home to take 2 more steps forward. And if we get it right and you do the 2 steps forward out of here in combination with the decompression, within a month we can start doing more focused strengthening of your neck muscles using MedX, okay? And I say focus to mean we're gonna do in the first part some general postural strengthening exercises that are low risk. They're gonna help you have more endurance for holding your head up as we do specific neck strengthening once we have some of this decompression underway. Okay?
I understand. Okay.
Okay. Is that helpful?
Yes.
Okay, questions?
So the decompression can be used outside of the home as well. So this can be something that I can do daily.
So at home
And
it's
it
called
helps.
traction because it's kind of static and these simple home traction units you can buy. So it has synergistic value. It's not the same thing, but when you use it at home, it helps everybody concerned, you most importantly, get momentum, not only at the clinic, but outside of the clinic.
Okay.
And therefore, on your subsequent visits, we can progress the strengthening more quickly than we would if you weren't doing some of this stuff at home. Yeah, and there's 2 types of exercises in general. One is more for mobility and one is more for strengthening. Okay,
Right.
some of the mobility stuff is like lying on the IntelliRoll or on a foam roll where you can help that area decompress.
That feels very good.
That also mimics the traction, okay? And also helps restore some curve in the neck. And once you feel better, then you can do the strengthening exercises. Because the first phase of goal, we got to get the pain to feel better.
Correct.
Because if we don't feel better, it's very hard to get somebody to strengthen because it's uncomfortable and there's material taking up space where it's not supposed to be. So when we start doing movement of the neck, we run into problems because we've got space occupying lesions, that lesion being the disc protrusion. Okay, so it's a general term to mean there's something where it's not supposed to be. Okay, and that disc protrusion being poking out of where it's supposed to be is the goal, is to help pull those back, okay?
And to have more spinal fluid flowing.
That's right, so that you will get more cerebrospinal fluid flowing, therefore you'll have less headaches, more, so people will typically get kind of like this pain across their shoulders, it can produce headaches. So those are the things that you can expect will get better. Now, in about 30 days, we'll do a re-exam. So we've taken ranges of motion, and what we can expect is those ranges of motion to improve. What was also very encouraging when we did yours is your ranges of motion were remarkably good. When we flex, that increases disc pressure, and that pushes the disc out, and that's what is consistent with that myelopathy, because when you bent your neck forward, you kind of felt this dizziness. Right. We would expect all that stuff to get better. You had pretty good extension, and that's what was very encouraging, because if a lot of disc material sticking out, extension is very uncomfortable. So, pretty good. Right and left side bent within normal range, and they were symmetrical. And symptoms did not increase with that. There's good signs that you're a candidate for this trial of decompression plus strengthening. So there's never any guarantee, because life outside of here has to be managed, and that's the hardest part of this equation, is making sure that your awareness is high. So we'll tape your neck, we'll do everything necessary to be mindful of avoiding unnecessary forward bending. Things like pulling the phone out, dropping your head are not helpful. So you need to be mindful with that stuff. We say lift your heart, eyes level. So that when you leave here, you don't undo some of the stuff we're doing. And that's the hardest part. And that's why people are really vulnerable to surgical suggestions, because they're in a lot of pain and they want to be out of pain. And it's not disparaging surgeons at all. When they do their job right, it can be a great outcome. But it's permanent and you can't undo it. So that's also not a perfect art either. And that's where, before you go to that decision, you're going to be more equipped if your neck is stronger.
Of course, that's what makes the most sense to me.
Yeah. So the decompression, so it's 100% clear, is to facilitate strengthening.
Yep.
And so what we use these machines called MedX, and you sit on the machines and you push a weight stack back and forth with your neck until your neck muscles get stronger. Preceding that, we will have tested your neck strength. There's some risk to testing the neck strength. That's why it's not the first thing we do. The first thing we do is decompression, home care, hands-on, soft tissue work, help you feel better, adopt the home care strategy, become more aware so you're not constantly aggravating that protrusion, and then in time start isolating those neck muscles to strengthen them. In the course of multiple re-exams over 60 days, we should see improvement of the strength. So that's the big one. So your shoulder abduction should come back to a full 5 out of 5. Bicep should come back to 5 out of 5. You should have less dizziness, less headaches, and all those things should clear up.
And that's when you determine I can start on the MedX.
Correct. Okay. Because the pressure is off the nerves, you're feeling better, and the risk is going to be lower.
Got it.
Okay? So that's the trial. Your job is to be vigilant about your posture and do some of the home care strategies and show up consistently.
Okay.
That's it.
That's
okay.
what I'm here for.
Let's go. All right.